Okay, so today is day 4. Day 1 was a welcome. Day 2, we talked about what your immune system actually is. Day 3, we talked about the 7 pillars of health. And so today, I'm going to start digging into each of those topics a little bit more. And before we actually get to food or nutrients or action steps you can take, I want to go back to what the immune system is for just a minute and talk a little bit more about leaky gut. Several of you asked questions when on the first day I asked you what you wanted me to talk about. Several of you asked questions about recovering from leaky gut. So many of you already know the correlation between leaky gut and having an autoimmune disorder or a lower or weakened immune system, which we covered a little bit, very highbrow, in video number 2. I'm going to run through a list of items that are all related to leaky gut, and they seem very unrelated, but the reality is that they all stem from the very same thing. This list is more than 3 pages long, so I'm just going to cover some of them. There are 650 different things that could all be really just one: leaky gut. Sometimes sugar cravings or carbohydrate cravings can be a symptom of leaky gut. IBS, acid reflux, indigestion, constipation, diarrhea, nausea, vomiting, difficulty gaining and losing weight, both, including children who are underweight or overweight. Anemia, iron deficiency and B12 deficiency. Nervous system issues or neurological damage. Sinus congestion, headaches, migraines, brain fog or memory loss and cognitive decline, vertigo, inability to concentrate, ADD or ADHD, depression and anxiety, including bipolar disorder and even schizophrenia to some extent, neuropathy, mood swings, restless leg syndrome, chronic fatigue, multiple sclerosis and Parkinson's, muscle and joint pain, migrating joint pain without an injury or an unknown reason for occurring, fibromyalgia, rheumatoid arthritis, lupus, psoriatic arthritis, gout, ankylosing spondylitis, Sjogren's syndrome, hormonal issues, difficulty falling asleep or staying asleep, infertility problems, or repetitive miscarriages, PMS, PMDD, thyroid disease, including but not limited to Hashimoto thyroiditis, as well as Graves' disease, diabetes type 2, hypoglycemia, polycystic ovarian syndrome, endometriosis, chronic immune problems, chronic urinary tract infections or upper respiratory infections, asthma, vaginal, oral, and other yeast infections, skin problems, fever, blisters, mouth ulcers, rashes, eczema, psoriasis, dermatitis, vitiligo, gallbladder problems, fatty liver disease, elevated liver enzymes, autoimmune hepatitis, lymphoma, certain platelet disorders, ALS. I'm trying to think if there's anything that I deal with a lot that is not in that list, but there's a brief list, okay? Many more things can be encompassed in that, but those can all be signs that the gut is leaking. So what is leaky gut? Leaky gut means that in that tube we talked about in video 2 that should have only 2 openings, beginning and end. There are little tiny holes, pinpricks that you can't see, microscopic openings that shouldn't be there. So what causes those microscopic openings and what happens when they're there? Well, when those microscopic openings are there, things leak into the bloodstream that shouldn't be there. Those can be good things or bad things. But because it's in a place it shouldn't be, the body attacks the invading whatever it is in an effort to protect your body. Sometimes it accidentally attacks you because you may have a cell or a protein that resembles that which is leaking out, and the body can't differentiate. It just knows something's where it's not supposed to be. So it attacks you to protect you from you. That's the definition of every autoimmune disease. The body attacks itself in order to protect itself from itself. And all these autoimmune diseases start with the integrity of the lining of the gut and the gut microbiome itself. All of these autoimmune diseases have the same root cause and respond very well to nutrition and healing the gut. And we're going to talk about that way more as we dig deeper. How does a gut get leaky? Well, there's a couple of different ways. Certain things we eat, certain things we're exposed to environmentally, certain things we're exposed to in the womb before we're born determine whether or not we're born with leaky gut. That doesn't mean it can't be fixed. It just means that this started before you were born. And then it compounded throughout your lifestyle based on choices you made. Choices you made that you didn't necessarily know could result in a leaky gut. Certain very specific things cause the erosion of the lining of the intestines, like grains, legumes, anti-nutrients contained in these foods, phytates, lectins, inflammatory responses to outside toxins and toxins that we consume. When a gut is leaky, in addition to the body attacking itself, it raises the inflammatory response. That's the body's response anytime something's wrong to try and fix it. But that inflammation becomes systemic inflammation. So systemic inflammation plus leaky gut plus a non-diverse or damaged microbiome, those three things together we see are the root cause of most disease and of a weakened immune system. So in the next video, what we're going to do is talk about how to make the gut healthy. And at that point, we'll start really digging into food and nutrients, and we'll start to get more specific as this ball gets rolling, okay? Again, thank you to the people who are new. If you just joined today, go back and watch videos 1, 2, and 3 so that you're all caught up. I look forward to talking to you each and every day this month on ways you can help yourself and your family boost their immune system.